If your doctor was honest, they would tell you three critical truths about your health. And why would I know? Because one, I'm a doctor. And these are three truths that I have learned over 20 years of taking care of patients as a family medicine physician and now as a lifestyle medicine physician. So check this out. Let's dive right in because I wanted you to be aware of the things that your doctor may not even know to be telling you. All right, number one. Remember, when you walk into your doctor's office, there is a clear expectation, right? You typically get a clear checkup, some advice, perhaps a prescription, and then you're on your way. But but if there but if time weren't a limiting factor in today's medical system, if every doctor really had the chance to sit down and tell you everything and have this great conversation and share with you what they've learned from years or practice or research, the conversation might look differently than it does today. Doctors are overburdened with administrative duties and, they're humans too. Things are crazy. But let's talk about the three critical truths that they just don't make it in the time allotted for a typical doctor's office. And these are truths that can profoundly impact your long-term health and well-being. All right, number one. And this is very powerful because I will tell you, this is the reason that I started diving into lifestyle medicine. Number one, lifestyle changes are more powerful than medication. I have been known to say that my food or a whole food plant-based diet, lifestyle interventions are way more powerful than anything that I could write for your prescription pad for the majority of chronic diseases. So, there's no question that modern medicine has made incredible advancements, right? However, the reality is that chronic health issues are best managed and in some cases even reversed, like type 2 diabetes, hypertension, cholesterol, through lifestyle modifications rather than solely relying on medication. All right, so the truth that gets left out of the conversation is that while medications sometimes can be life-saving and are necessary in certain situations, they are frequently used as a short-term solutions for long-term problems, right? So conditions like high blood pressure, type 2 diabetes, heart disease can be managed effectively with diet, exercise, and overall lifestyle habits. And so there is a tremendous growing body of evidence that shows that adopting a whole food plant-based diet combined with regular physical activity and stress management can lead to profound improvements in your health. These changes not only address symptoms, but they get to the root causes of many of your chronic diseases. So what you need to know is that medication is not the only option here, right? Your doctor's toolbox is full of other things, especially if they are lifestyle medicine certified. So by focusing on fundamental lifestyle changes, you have the potential to achieve way more sustainable changes to your health, long-term health, than just taking a prescription. And I will tell you, it was from a patient who literally, she was 16 years old, stopped 2 attention deficit disorder medications after 30 days of eating a whole food plant-based diet that got my attention. And I will tell you, I have not changed my interest in diving into the science about this since then. And that's been almost 13 years. All right. What is the second one? Number 2, mental health, stress, and sleep really are the cornerstones of your health. They're like think of them as a triangle that when one is not working, the other two get really bent out of shape, right? So while the focus of many of your medical appointments is diagnosing and treating physical symptoms, there is often insufficient time and attention given to the role of mental health, stress management, and sleep quality in your overall well-being. Yet these are really critical for good health. Most of the time that we start talking about sleep is when patients have something that points that sleep might be an issue. Maybe they have hypertension or heart failure, or maybe they're just chronically fatigued. Then we speak to them about their health. But it's never the top thing that we're discussing because we're always looking at physical elements. We have limited time. And like, what is the next prescription I can give you to get you out of my office? And like I said, doctors are doing the best they can. And the majority of them care so much about their patients, but they're just in a broken system. And let's talk a little bit more about the chronic stress. That can really lead and even exacerbate a wide range of conditions, including cardiovascular disease, digestive disorders, and even stress. I've absolutely seen stress worsen autoimmune diseases. It's incredible to me how sensitive we are to our mind and dealing with stress, and our bodies respond, right? There is a mind-body connection, and the sooner we understand that in modern medicine, oh, we'll be so much better for it. But remember, similarly, insufficient sleep can have a far-reaching consequences from impaired immune function to increased risk of chronic diseases like diabetes and hypertension, heart disease. So again, despite their importance, they are just not prioritized in the typical medical setting. So what you need to know is that managing stress and prioritizing sleep are just as important as nutrition and exercise, okay? These are not ancillary concerns. They are foundational to good health. So what are the 4 things that I really, really want you to focus on there would be a whole food plant-based diet, 7 to 9 hours of sleep per night, regular bedtime. I have tons of other videos on sleep, managing stress, specifically if you incorporate mindfulness into your day-to-day practice. Again, tons of videos on mindfulness, and just really, really, really thinking about, your exercise that you're doing every single day. You've got to move your body, guys. Motion is lotion for the body. And again, I got a ton of videos on exercise. But finally, let's get to the next secret that your doctor, if they were honest, would tell you, that you, my friends, have more control over your health than you realize. Okay? One of the most empowering truths that often goes unspoken is that you, as a patient, have far more control over your health than you realize. Now, while doctors play a very important role in diagnosing and guiding treatment, the choices you make every single day have a profound impact on your overall health. Think of those choices as interest on a bank account. The more you put into your bank account, the interest will compound over time, and you get healthier, which is wealthier in the sense of your physical, mental, and spiritual well-being. All right, so remember, this really extends beyond diet and exercise to include awareness of hormonal health, environmental exposures, and lifestyle habits, right? For example, hormonal imbalances can affect everything from energy levels to metabolism, but yet they are often overlooked in your routine medical care, like menopause. Like I talk about this all the time. When you don't have estrogen, which you've had the first 50 some odd years of your life, things are going to change. And someone needs to be able to talk to you who's educated and understanding the more recent data and how that can be very beneficial to you. Again, environmental toxins from household cleaning products to pesticides in food. These can really accumulate and contribute to a variety of health issues over time. But the good news is that with informed choices, you can reduce your exposure to harmful substances. You can absolutely change things in your body by addressing everything that we talked about earlier about these lifestyle habits and so much more. But I really wanted to share with you that you, my friends, are not simply a passive recipient of medical care. So by educating yourself and making informed lifestyle choices, you have the power to significantly change your long-term health. And doctors are there to be your guiding light, but they are not the heroes of this story. You are. You're the heroes of your own journey. And so please don't negate that and think, oh, my doctor knows everything for me. Have conversations. If you're not getting the care that you need, ask them to have more conversations, or maybe even just make an appointment to discuss everything that's been going on, to go over your medications, right? Maybe instead of going in with complaints, maybe it's like, hey, I want to come in and look at solutions. What can I do? Here's my habits, and here are my medications, and here's what I can and can't do. Doc, can you help me to incorporate healthier lifestyle habits to help me get off some of these medications, or at least decrease some of the dosages and feel better? So don't be afraid to make appointments to actually say, hey, what can I do to help myself get well, right? So don't just tag it on at the back end of complaining about different things, but go in with the whole attitude of hey, let's work together to get well. I guarantee you, no patients do that. And your doctor will be so thrilled to have a conversation like that with someone. They will be on your side and they will help you. I promise you. And if they don't, you need to find another doctor, because they should be tickled that someone would do this. So there it is, guys. The 3 secrets, if your doctor was really honest with you, is that lifestyle changes are more powerful than medication. Mental health, stress, and sleep are the cornerstones of physical health, and you have more control over your health than you realize. So I hope you found that helpful, and I loved talking to you guys today. As always, I'm sending you gratitude, joy, love, and peace, and healing above all else, because we all need more of that in our own lives and in this world. So thank you for watching, and I'll see you next time. Bye, everyone.